Hello, friends. If you or someone you love is anxious, you might be wondering what exactly is causing the anxiety. The answer is not always very simple, so hang with me as I get to the bottom of this, as there's often many different causes of anxiety that people often don't consider. And for those of you who are new here, welcome. I'm Dr. Omar. I am a doctor, but I'm not your doctor, so just wanted to remind you that everything here is educational and entertainment, not personalized medical advice. So, when you're feeling anxious, it may be because of a particular trigger. You want to think deeply first about what exactly anxiety is. Anxiety is not the same thing as stress, and it's not the same thing as just noticing something and being startled. And remember, anxiety at low levels in certain contexts is totally normal. If you're running away from a bear, you better be anxious. But when things become dysfunctional and you're feeling a panic attack, for example, when you're not running away from a bear, we call that panic disorder. Let's go a little deeper into some of the causes here. First of all, there's something called generalized anxiety disorder, which is a mental health disorder where there's a predominance of ruminations and ruminative anxiety and worry and a constant feeling of being overwhelmed. And the anxiety has to be at a clinical level of dysfunction and distress and needs to be in multiple different contexts. So that's one possible thing that might be going on if you're feeling anxiety. Another option is obsessive compulsive disorder, otherwise known as OCD. And, and as the name suggests, there's both obsessions about particular items, such as a fear of germs or a fear of asymmetry in objects or a fear of social harm, as well as compensatory compulsions or behaviors. And again, this is something that needs to be diagnosed by a professional. Just because you're somewhat clean doesn't mean you have OCD. Similarly, there's something called somatoform disorder, which is a condition where anxiety is prominent, but often the anxiety is focused on physical symptoms of the body, and oftentimes no physical or organic causes can be determined. For example, persistent types of pains in the body, or persistent nausea, or other types of dysfunction where bodily preoccupation is a major symptom and anxiety is often a presenting complaint. So there's many different ways that anxiety can present in your life. Similarly, you might have depression or what's clinically called major depressive disorder. And here, ruminations and negative interpretations of events can be a part of the depressive experience. And this can come with some levels of anxiety. And often people with depression also have generalized anxiety disorder. But the depression itself will include things such as low mood, difficulty enjoying things, a lack of energy, difficulty with concentration, and sometimes even suicidal thoughts. So it's important to disentangle the different flavors of anxiety that one could experience. Similarly, there's something called adjustment disorder, and this might be in reaction, for example, to a car accident, where you have an excessive reaction to a stressor that involves a lot of negative thoughts and difficult emotions and dysfunctional behaviors, but typically these reactions are time limited and they dissipate over time. In addition, there could be panic attacks or panic disorder where somebody has anticipatory anxiety and a feeling like they're going to have a heart attack or that the world is just about to end. And oftentimes panic is a sudden, intense form of anxiety and typically lasts a few minutes and has a different presentation as compared to other types of anxiety disorders. Also, there could be substance use or substance abuse. Various different substances reduce the threshold for experiencing anxiety and have anxiety as a side effect. For example, with cannabis or marijuana, somebody could have paranoia as a reaction or some other type of anxiety as a result. Nicotine, caffeine even, cocaine, amphetamines, of course. But we should always consider substances as resulting in anxiety as a side effect. In addition, medications often have anxiety as a side effect. So pseudoephedrine is a good example. Like I mentioned, caffeine and nicotine and other often very benign medications can sometimes cause anxiety as a side effect. And then sometimes it's not the substance itself that's causing the anxiety, but the reaction to when you end taking the substance. So for example, alcohol, when people are taking it, doesn't cause anxiety, but it relieves anxiety for the short term. But after the effects of the alcohol wear off, people have often more anxiety because of what's called withdrawal. And this is also seen with the number of medications, especially if these changes happen suddenly and they're not weaned off very slowly. There's also medical causes of anxiety. For example, something called pheochromocytoma. And this is when the adrenal glands, which are seen over here, have some abnormal cells that produce hormones that increase in concentration, things like norepinephrine in your bloodstream, and that can mimic panic attacks and anxiety and also cause a lot of high blood pressure. And similarly, if you have a hyperactive thyroid, this is often a very common underdiagnosed cause of people having anxiety. And too much thyroid hormone causes anxiety as a side effect because the body's metabolism is really sped up. And often there's other symptoms as well, like tremors, weight loss. And so when you're thinking about anxiety, you want to think about all of these possible causes and don't just jump to the first possible explanation. Look at the person in their entire context and try to consider all the things that might be affecting somebody, because it's very easy to misdiagnose people. And we want to make sure that we get people the right treatment. And we can't do that unless we really know what's going on. So thanks very much. If you appreciate this, like it. And if you want to see more like it, please do subscribe. Thanks so much.